there's lots of different ways in which we can interact with nature. Sometimes it's a very managed sort of setting. Sometimes it's to grow food. Sometimes it's just to engage with wild spaces, spend time in the park. And we often think of nature as something like this, right? Something that's sort of out, maybe away from an urban setting or a setting that we find ourselves living in, and that we might not have access to. But it's important to remember that nature really exists everywhere. We are nature, right? There's nature in our homes. If we have plants, no matter how small, in the curbs next to our houses, growing up out of a stone wall or in a window box, which you can see down here in the center. This is actually the world's smallest city park. It's located in Portland, Oregon, and it's about 16 inches across, but it has park status. So really just different ways of showing that you can find natural spaces and natural objects to interact with really anywhere. So if you feel like, maybe I'm a little bit disconnected from nature, sometimes that really just means we need to change our perspective and look a little differently at the world around us to find that natural space that we can use or engage with. So some of my objectives for today are to provide you with a review of the research and theory for nature's role in health and wellness. So I'll cover some general findings on health and well-being, as well as some research specific to aging adults. I want to describe just some different applications of the kinds of activities people can engage in, promote health in nature, particularly talking about forest therapy, what used to be referred to as Shinrin-yoku, or forest bathing. It's a practice that kind of emerged out of Japan in the 80s and 90s. I'll give you a little history there. And then also talk about horticulture therapy, which is a kind of a structured practice of interacting with nature that's generally geared towards older adults or people with disabilities. So we'll talk a little bit about how those are used and how some of those practices can be leveraged at the personal level as well as maybe the institutional level. And then also at the end, I'd like to provide you with some advice or some ideas on special considerations for both patients and practitioners that are going to address some of the considerations that need to be made when working with older adults, right? Sometimes there's mobility issues, things like arthritis, other health-related concerns. And it's important to note that there are options out there. There are tools out there that can really help people engage with nature, things like gardening, really well into late adulthood and really throughout the lifespan. So it's not something that needs to necessarily be abandoned. And again, so ways of thinking creatively about that process. Let's start with some of the general research and some of the theories behind the role of nature in health. And most of the research really goes back to this kind of seminal work by Roger Ulrich in 1984. And Ulrich had this really nice naturalistic experiment that he was able to carry out, looking at patients on a surgical ward recovering from gallbladder surgery. And some of the patients, as you can see in the diagram here on the screen, some of the patients had a room with a view of a brick wall. That's sort of the first floor closest to the hallway. And then the latter four rooms have this view of some trees and some grass in the background, right? So it's, do you get a natural vista or do you see a brick wall building exterior? And what happens? All these people had the same surgery, so they're recovering from the same issues. So it was very, relatively well controlled for a natural study. And what they found was that individuals who had the natural vista had shorter stays, about 2 days less while in the hospital. They required less pain medication during recovery. They had fewer post-surgical complications, including infections. And they were better rated by the staff in terms of interpersonal variables. So the nurses found them to be easier to get along with during recovery. And collectively, this meant that there was an overall lower cost to the hospital and patient because of the shorter stay time and the less need for intervention. And so this was kind of the first sort of sit up and take notice study that was carried out that particularly healthcare organizations attended to, and it kicked off something called biophilic architecture, in a big way, which I'll talk about here in a minute. But this is really kind of the first big study to emerge, and then slowly in the 90s and then into the early aughts, and especially in about the last 10 years, things have really picked up. And if you're at this talk, you probably come across this idea at least somewhere. Much of the research that's been carried out over the last about 15 to 20 years or so has been done in Japan, largely headed up by this gentleman here in the larger picture, Yoshifumi Miyazaki of Chiba University in Tokyo. I had the opportunity to go and spend some time with his lab some years ago, as well as Dr. Song standing behind him. And they've done a variety of studies, both within the laboratory. So the space that he's actually in, that room is a sealable room that they can change the air quality in to test volatile plant compounds, effects on well-being, mood, and physiology. Or they can do outdoor studies. So a lot of the research studies that were initially carried out there, excuse me, were case control studies that looked at natural environments versus built environments and tested physiological effects, heart rate variability, which is a measure of autonomic activity of the heart, looking at blood pressure, looking at cortisol levels and stress hormones. And then down there in the bottom left, a gentleman who is a certified forest therapy guide. So one of the things that Japan has been able to do is essentially certify forests throughout the country as healing forests, places that patients can go, supported by the National Health Service, to spend time in nature, either for a weekend or even just for a day trip. And it's Mura-san's job to basically take them around and to help them to experience the natural space and engage in the forest therapy practice. And I'll talk a little bit more about the details of that as we go. So what are some of the effects, right? So to just give you kind of a general summary, down at the bottom, for those of you that might be interested in looking into it in more detail, I've listed some citations for some of the review studies and available meta-analyses. We're now getting to the point where there's enough data out there to begin to support meta-analytic research. The quality and level of detail within the studies is something that's still, I think, picking up. So we don't have a lot of effect size measures, unfortunately, for those of you that think about those sorts of things. But these are all well-controlled kind of experimental studies. So these aren't correlational findings. These are effects that are involved in spending time or interacting with nature. And we can really break them across 4 categories, right? The physical, the emotional, the cognitive or mental, and the social. And as healthcare providers, we're particularly interested in these physical effects, improvements in sleep quality, the promotion of immune functioning, increased cardiac efficiency, which is always a concern, especially after a history of heart attack, blood pressure, blood glucose levels, as well as hypertension. We know diabetes and heart disease are major issues that aging adults have to deal with. And spending time in nature appears to have very measurable and somewhat long-standing effects. So particularly things like blood pressure, blood glucose, and hypertension responses to spending time in nature can be relatively long-lived, maybe even several days of effect following even a short 20-minute exposure. In terms of long-term cognitive effects, and I'll talk a little bit about the cognitive model behind why we think this helps in terms of nature and health, improvements in working memory, attention, reduced ruminative anxiety, and also reduced prefrontal cortical activity, or the part of our brain that kind of modulates and regulates our attention, appears to be a little quieter when we're spending time in nature. And we have some hypotheses to posit why that may be. Positive emotional effects, increased coping and emotional regulation abilities, reduced negative mood. And then these social effects, which we'll come back to a bit later, have largely been studied in aging adults who are spending time either in horticulture therapy practices or gardening or just interacting and working with plants show improved sense of self-worth, increased prosociality, more interpersonal connections, and subsequently reduced sense of loneliness. We know loneliness is also a huge issue for aging adults, particularly those in long-term care. And so questions of how can we reduce this negative effect, which we know is going to feed back into the physical, the cognitive, and the emotional as well. So a variety of positive effects going on here. What's happening? What's the process at work? And there are 5, we would say, kind of working theories for how some of these effects occur that go all the way back to Ulrich's early work. Some of them are better supported than others, but these are kind of the top 5 that we're generally working with, and they ultimately come together to create sort of a heuristic model that most people who are interested in nature and health are working in. So I wanted to just kind of briefly review those so people in the audience would have some general understanding about how we're thinking about these things scientifically. So if we go all the way back to Ulrich's study, that was that first study looking at the room with the view. Ulrich developed this idea called the stress reduction theory, or the theory of supportive design, which has affected how we think about designing spaces with natural elements. And so Ulrich's idea, right, is there are these variable environmental factors and elements that can promote well-being. That might be a view, image of trees, the presence of water, the presence of plants. It could be surfaces. You'll notice the background of my slides are a nice piece of cypress wood because I think that's more soothing to look at, right? So that's an aesthetic kind of consideration in terms of having an effect on stress. And Ulrich's idea is that designers should really try to attend to the presence and accessibility of these sorts of elements in healthcare or other spaces. And I'll show you some examples in a moment. And so we've got 3 factors that we think are at work. So there's a mediational model for how the presence of these favorable elements ultimately affects an individual's well-being. And the expectation is that these elements lead to things like a perceived sense of control, right? If I have some plants that I take care of in my house, I interact with them, right? I feed them, I water them, maybe I talk to them. I have a sense of agency, right? And that sense of agency promotes my sense of well-being. If I'm engaged in maybe a local community garden, that can promote social support and social interaction. If I'm focused on my plants and I'm not focused on work stress, that would be positive distraction we see here at the bottom. And so presence of those elements are all going to lead to affect well-being. And according to Ulrich's research and some follow-up studies that have tested the stress reduction theory, it's really the social support and the positive distraction aspects that are particularly important. And so from this theoretical perspective, if we're thinking about what are the elements that we want to include in patients or clients or our own lives, ways that can promote social support and ways that can motivate kind of positive distraction, or we could think of positive distraction as engagement with nature or interaction with nature as having the positive effect on well-being. And so those are the 2 kind of largest effect areas that we can focus on in the promotion of well-being, social support, and distraction. And so Ulrich's ideas, like I said, led to a increased focus on the role of natural environments and the importance of natural environments in the promotion of well-being. And what we see here are 5 different locations. These are around the world. We've got the Iowa Correctional Facility Institute for Women. This is outside Des Moines, Iowa. Jupiter Medical Center in Florida, hospital in Singapore, Henry Ford Hospital in outside Detroit, Michigan, and Menora Park Skilled Nursing Facility, which I believe is outside Cleveland, Ohio. And so these different spaces with a very intentional focus on the inclusion of natural spaces, natural surfaces, and natural structures in easily accessible locations for patients. And as you can see, there's a Jupiter Medical Center for healthcare providers as well to take time out. And if you look at the spaces, what you'll notice, one is a lot of green, but you'll also notice a lot of organic form, right? Curves as opposed to hard angles. And if we think about the way most of our healthcare facilities are designed, they aren't often designed with this in mind. So this is a different sort of perspective on how to approach looking at design that can have a positive effect on well-being. And so where does this well-being come from? Why do we enjoy these spaces? Well, if we look at these two images here, you can just like take a moment and choose A or B. I like to use this one when I present on this topic with my students, particularly because it forces us to ask this kind of question of what is it about natural spaces that we enjoy, right? Is it the nature? Is it the shape? Is it the color? Is it the light? Is it some combination of all these things? So look at image A and image B and just choose one kind of first impulse and see what you like. And then take a moment to think about what it is about that space that you enjoy. What you might notice as you look at these two images is you might be more drawn to one than the other. And in most instances, and this is not in a controlled experiment, but in most instances, people choose option B. And some of the things that they cite in option B is that it appears a little more bright. The trees are more interesting. A lot of times people have a hard time sort of explaining what it is about the trees that they like, but they seem to like those trees better. Some people will identify that the trees seem easier to climb, so maybe easier to access. Also, they might provide more shade. It looks like this place might have more food is a comment that I get a lot. And so this is a way of illustrating this concept called the biophilia hypothesis. The biophilia hypothesis was posited by sociobiologist E.O. Wilson, as well as psychoanalyst Erich Fromm in the 1960s, and then Wilson brings it up back again in the 1980s. And what Wilson's idea is that this connection that we have to the natural world, or these things that we like about the natural world, we like for a particular reason. That is that they have some evolutionary adaptive value. It's not really a testable hypothesis per se, but it's an interesting idea to raise the question of, you know, why do we settle in certain locations? Here we've got an example of a Saroyama region in Japan, and then a space in the Swiss Alps, right? People settling kind of near forests, but in somewhat a gregarious space, usually near water. All of these things necessary for our survival. And so Wilson's idea is that it's natural for us to choose spaces that are going to aid in our survival, and that we are going to be drawn to those spaces in our daily lives. And the further away we get from them, the less sort of connected, the less sort of comfortable, the less sort of enjoyment we're going to experience. And so when we look back at these two images, you know, what we might be seeing is, well, the trees in B are easier to climb. Therefore, they would provide us with a greater sense of safety and security as a primate that spent a lot of time wandering around the savannas in Africa, that it's a safer, maybe more enjoyable space, and we are therefore drawn to it because of that sort of history. So it's these sort of first sort of human spaces that we inhabit, and that we want to continue to inhabit them where possible. So while an interesting way of framing, it doesn't provide us with a lot of scientific use or the ability to test effectively. One theory that's gotten a lot of traction over the years since the late 1990s is what's called the attention restoration theory. This was developed by Kaplan and Kaplan, and it looks at particularly the cognitive effects of interacting and spending time in nature. So it understands attention as a kind of resource, which is a pretty common way to look at attention psychologically. And it says basically that we have a capacity for directed attention, like our ability to focus on objects, your ability to listen to this talk, or drive a car, or get your work done, or do whatever it is that you do during the day, has a finite amount, right? And the world is constantly drawing on that directed attention. So there are requirements of directed attention. And as these requirements increase, and they can draw from a variety of places, right? Busy traffic, lack of sleep, lots of work to do. All of these things Kaplan would describe as effortful attention, attention that requires a significant amount of energy and focus on the part of the viewer. Well, effortful attention, as you can imagine, is draining, right? We all experience this whenever we're doing something that requires a lot of focus over time. What that does is ultimately deplete our directed attentional capacity. And as that depleted attentional capacity goes down and the effortful attention requirements of direct attention go up, we experience fatigue, right? So what is it that makes us tired at the end of the day, right? Well, we've been thinking all day. So how does nature affect this? Well, in natural environments, nature has a different set of patterns of demand, we could say, on attentional resources. So, a cell phone or a car or a complex work task all require us to track a variety of objects. And those objects could be actual things, or they could just be ideas or processes. Nature, on the other hand, has what the Kaplans call a soft fascination and an effortless attention. Nature is very interesting, right? We enjoy the light coming through the leaves on a tree or the sound that the wind makes. All of these things are engaging, they're interesting, they draw our attention towards them, but they don't require a lot of cognitive effort. So the idea is that nature doesn't make the same kind of directed attentional demands as the built sort of busy mechanical environment does. And that thereby allows our directed attentional capacity to be restored. Some would go so far to argue that because as a human organism, we have lived in the natural environment for roughly 99.9% of our evolutionary history. And it's really only in that, 0.1% sort of time frame over about the last, we'll say, 8 to 13,000 years that we lived in structured settlements inside homes, and then beginning to build cities, and then sort of becoming a little bit further and further away from the natural environment. And so the argument could be made to some degree that the brain and the body, our sensory and perceptual systems, our cognitive systems are tuned to operate in a more balanced manner in the natural environment versus the built environment. And so when we can create this kind of balance between directed attentional capacity and attentional demand, we experience restoration. And so the Kaplans would go on to say that there are certain specific things about the natural environment that allow that restoration to occur. And they generally focus on 4 that have an effect on what's called in literature perceived restoration. One of those is being away, just getting away from work, getting away from our normal day-to-day experience, getting out and engaging with the natural world. And you don't have to get out very far, but just sometimes it's just getting away from your desk, or getting out of the house, right? If you spend a lot of time inside during the day or inside your apartment, simply going outside for a bit can be a form of being away. Not only is getting away important, but also this idea of extension, or what's sometimes called extant, or the variety that nature offers, right? There's arguably sort of an infinite number of qualities or spaces or types of nature that we can interact with, right? The light's different, the air's different, the temperature's different, the trees are different, the seasons are different. There's always something new, right, to find. And the closer we look, in some ways, the more we can ultimately find. Nature can fascinate us. Nature can fascinate us, like children kind of playing outside. And nature has a degree of compatibility. And this is one I want to focus in particular on, given the audience here, and that's that depending on the compatibility of the natural environment that we find ourselves in, we're going to experience more or less restoration. So finding ways to match the environment with what we can do, right? So if you have mobility issues and you're trying to move around in a, difficult to navigate environment, you're probably going to be more stressed than you are restored. And so thinking about what are the sorts of spaces and interactions that you can create or that can be created for you that are going to be most compatible, right? So what are your limitations? What works for you? Can you work with someone to help kind of find out what works best? So choosing the right kind of parks or the right kind of spaces is particularly important. One of the more recent models also that's been presented looks at emotional regulation as a possibility or as a possible mechanism for improvement in overall health. And this says that we essentially select certain situations purposefully, and that in doing so, we can sort of modulate or deploy our attention in a particular way. So certain environments are easier or more difficult or place more or less demand on us in terms of our attention, in terms of our thinking. And so by going into a natural space that is particularly compatible, maybe interesting or enjoyable, someplace that we like, maybe our garden or our own yard, or interacting with our houseplants, that's going to be a positive distraction, which is going to orient our attention towards something that we enjoy, which means that if we're worried about other things, that might push those things sort of out of mind. Again, we've got a finite amount of things we can focus on. So if you're focused on, say, something negative and you direct your attention towards something else purposeful, like an activity, like gardening, that you've only got so much room in your head at that time, and that usually leads to a shift in focus, a shift away from ruminative anxiety. And that's probably why we see decreased rumination when people interact with nature. Also, if we experience agency and capability in that space, like if we're getting things done and doing things that we enjoy, that means that we might experience this positive cognitive change of reappraising the situation or our experience in a different way, and reducing the likelihood that we're going to engage in a kind of suppressive avoidance of anxiety or whatever uncomfortable things that we might be thinking about. And that's going to feed back into or motivate us to engage in the situation again later. The final hypothesis I want to mention is a really interesting one. It's presented by Dr. Ching Li, who's one of the other sort of major early researchers in the area of nature and wellness. And Dr. Lee's idea is that phytoncides, or volatile organic compounds released by plants, basically the things that makes plants smell good, are what improves our overall well-being when we are engaged with nature. So we're breathing these things in, and they're having a immunological effect on the body. And you can see me down there in the bottom corner in a cypress forest in Japan on a forest therapy trek with Mira-san, and breathing in the phytoncides being released by the cedar trees that are there. And phytoncides are everywhere. Like, they're what make hops smell kind of funky. They're what make lemongrass smell fresh. They're what make geraniums smell sweet. This image over here on the left-hand side is a Kirby Bauer plot that some students of mine made. And it's looking at a couple different essential oils from plants, which are these phytoncides, pinene, which is the constituent in pine and other sort of evergreen smells, lavender, cedar, frankincense, and then there's a control in the center. And what you can see is there's a sort of a blank area surrounding some of these discs that have been impregnated with these oils. And those are zones of inhibition, or areas where these different kinds of bacteria aren't growing, right? So they have antimicrobial properties that are pretty well established. Some even, at least in lab-based studies, have been shown to be anti-proliferative. So it can actually destroy cancer cells. Again, we don't know much about dosing or how this would affect sort of individuals, but we do know there are studies promoting improved sleep and improved immune response simply by diffusing essential oils from plants into the air in rooms that people are sleeping in. So if you're somebody who enjoys aromatherapy, finds it relaxing, there is emerging science to suggest that some of these compounds do have very direct physical benefits on the body. Dr. Lee's hypothesis is that we, in a sense, have co-evolved in natural spaces with these plants and with these chemicals, and therefore these chemicals signal our immune system in ways that we are only beginning to understand in the promotion of health and well-being. And so if we put this all together into a kind of framework, how can we think about all these different theories together, like in a singular focus? You can say, like, well, under stress or in a stress state, nature can present us with some restorative effects. That is, it reduces our attentional demand, our cognitive load, exposes us to antimicrobial compounds. We're engaged in some degree of low impact physical activity. So that's something that's great. We know more and more studies coming out, especially in the last 2 years, showing just how helpful physical activity is for both physical and particularly mental well-being, and the potential to promote social interaction with others. We know there are individual differences that are going to moderate these things, like SES, like location, like access to nature, and those are definitely going to need to be studied more directly as we understand this process better. But what ends up happening is we get the potential for physiological relaxation, which we know is good for us, improved immune system recovery and functioning, and then also potential cognitive restoration. And if we use this coupled with evidence-based medicine, and Miyazaki's very adamant about this idea that these are not alternative forms of treatment, these are adjunctive forms of treatment. These are things that we do along with the medical healthcare practices that we have established to help increase their effects, right? And so to create a kind of preventive medical effect to promote future well-being. One of the main candidate pathways that's presented, I won't walk through this one entirely, but I do want to show you that Kuo et al. In 2015 presented this model as saying that it's primarily through the process of immune function that we see improvements and positive health outcomes associated with interacting with nature. While there are a variety of active ingredients about the natural environment that are promoting our well-being, that are affecting our physiological and our psychological states, as well as increasing health behaviors, that all of those are really ultimately affecting the immune system. And so the immune system is probably going to be the next big, particularly in from a neuroscientific perspective, and a medical perspective, is probably going to be the next big area that we're going to be attending to and trying to understand how nature promotes health and well-being. So let me transition now to talking about research on aging adults and then making some recommendations for you. And that should bring us right up until about the 10-15 minute mark at the end, so I can take any questions. My apologies if I've been talking fast, but there's a lot here, plenty that I want to get through. Certainly I'm excited about this topic as a researcher and a practitioner in mental health. So some of the research working with aging adults looks at particularly just exposure to nature, and that exposure can vary in terms of, is it immersive? Is it simply spending time in nature? Or is it also interactive? Does it require that we work with nature? And are there different effects in terms of how, say, intense your exposure is or interactive your exposure is? A sort of special case worth addressing is the practice of gardening, because gardening can be done indoors or outdoors. Does it make a difference to work with a houseplant versus, say, growing your own food? And then finally, looking at the practice of horticulture therapy. So like I said, this is activity-based, often occurring in residential facilities, like I said, with older adults or persons with disabilities. And it's kind of gardening, but in a structured therapeutic way. Whereas gardening, we might think of that as just more sort of self-guided practices. So in terms of some of the data and research on nature's effect on older adults, we see a lot of the similar benefits in older adults as we see in many of the younger adults who've been studied. So a lot of the studies that I presented the findings from earlier focus on, as most psychological studies do, college age young men and women. Although there have been a number of studies looking at kind of middle adulthood people with hypertension or diabetes to look at those effects. And so some of the main effects we see with horticulture therapy and practices like indoor gardening are increased psychological well-being, promoted sense of self-worth and social connection, and then reduction in physiological factors like hypertension, and like I had said before, reduced depression and loneliness. And so these are individuals who are either living in long-term care skilled nursing facilities or are in some sort of like supervised setting that researchers were working with to look at practices of gardening kind of in settings outdoors, like maybe a garden that's attached to the facility they live in, or doing things like transplanting seedlings or doing plant starts. And so sometimes it'll be, putting out a seed tray, having a person work on their kind of fine motor skills, placing seeds in the tray, putting them in a germination hood, letting them germinate, transferring them out to pots or transferring them into a garden. And so it can be kind of really low impact, or it can be more active kind of indoor outdoor type activities. Some really interesting findings regarding patients with dementia engaged in horticulture therapy practices show reductions in problematic behaviors. So reduced negative mood, sometimes reduced aggression and outbursts, increased engagement with ADLs, and engagement with community activities. So just sort of more outgoingness, more engagement, more interaction. And this one is really interesting and I think important to attend to. About a third decrease in falls in the samples that were studied. And that's a big, it's a big problem, right? That lots of people deal with. I know as my grandparents were aging and as my parents age, that's a concern, right? Is mobility and movement. And gardening and spending time in nature asks us to interact in these sorts of ways that are going to keep us physically active well into our adulthood in low impact ways. You might be asking how much is enough, right? How much time should I spend in the garden? How much time should I spend with my plants? And it's variable. We're starting to kind of learn the answer to this question. But some of the sort of best done or best designed studies that have been worked on so far show that about 20 minutes at a given sitting, so this could be walking in a garden or spending time in a garden, can lead to about a 2 to 4 day physiologic shift in blood pressure, and then ongoing effects on blood glucose fluctuations. And then in general, overall total of about 120 minutes a week, which interestingly enough is about the same amount of time that's recommended for spending time engaged in light to moderate exercise for most adults. In terms of volume, I would say as much as you're able to do. So, working within what boundaries you have. And, while this talk is geared towards older adults, many of you may have grandchildren or children. When to begin? I would say start early. Kids are built for nature. They love being outside. They love getting dirty. They love interacting in these sorts of spaces. It teaches them resilience. It teaches them how to navigate physically and interpersonally, and so better to start as soon as possible. Tanya Denkla-Cobb, as well as the Swedish sort of forest therapy organization a while back, have developed what's called the nature pyramid, that suggests that really daily we should be engaged in, if you see at the base of the pyramid, just kind of, just going outside, right? On a weekly basis, they suggest accessing a park or someplace that's a little bit further away from a setting that you might live in. And then monthly and then yearly, we're looking at really getting out and really traveling. And while this is an idealized kind of way of looking at how we can interact with nature, remember the biggest part of the pyramid is the part that is just going outside, just interacting in our yards, or with our plants. And so it raises a really important question about access. When we want to access natural spaces, it's important for us to consider that not everybody has easy access, depending on where they live. The images here are from urban area in Philadelphia that was greened up by the University of Pennsylvania's College of Medicine, and they looked at community engagement as well as crime rates in the area. Both showed a drop. Particularly community engagement was affected positively. Han and Ruan showed that it really doesn't matter if you have plants indoors and what those plants are versus having like a big garden outside. There's still positive effects. So there are options available for really anyone. So while we look at the nature pyramid, it may seem like you need really all this time, all this kind of getting out and getting away, and that really doesn't seem to be the case. Anything green, getting your hands in the dirt, even if it's on your tabletop, can be helpful. So let's talk about some of the methods and applications, and then we'll move on to questions. So as I mentioned, forest therapy is a practice that is growing in popularity. And if you're interested, I would encourage you to Google just the term forest therapy or look into the Association for Nature and Forest Therapy. They're a sort of a certifying body that registers guides to take people on forest therapy walks. And they also list people in different areas around the country. So I believe there are 2 guides in the Louisville area and then another in the Lexington area that are available for guided treks. And you might be like, well, why do I need a guide to go walk out in nature? And it's like, well, forest therapy is a particular kind of structured practice. It involves spending time in nature. Forest therapists will commonly say that nature is the therapist. They are just serving as a guide in the therapeutic process. And so how do we engage with the therapist? We engage through sensory focused activities, olfactory activities of smell, visual activities, auditory activities, listening to the sounds of nature. And oftentimes a forest therapy walk will be maybe only a quarter mile long, but it'll take about 2.5 hours. So it's really a short distance over extended duration, which can work really well, I think, for aging adults. And the location can really be anywhere that's going to bring people in contact with natural objects. So if you have a gardening that's available, or local arboretum, or Louisville's extensive park system, all of these can be used to effectively promote interaction with nature. I'm also really interested in the idea of the fact that these are very sensory focused activities and how that plays out or may play out with aging adults, where we obviously see reductions in hearing, effects on other sensory modalities. Does forest therapy, because it activates these senses more readily, is that a way to potentially stave off some of the aging processes associated with our sensory space? And that hasn't really been studied yet. Something more structured, like horticulture therapy, we can see being carried out here, involves therapeutic gardening in a plant-dominated environment designed to facilitate interaction, right? So these are kind of structured ways of playing in the garden space. It can be passive, so it can be just sort of sitting and hanging out, but it can also be very active, right? And the idea is that horticulture therapists, and this is much more common in Great Britain than it is in the United States, but I think it's starting to pick up some traction here. Horticulture therapists are really focused on, in the same way that an occupational therapist or a speech therapist are trying to work out, okay, how do I connect with and support the well-being in my client? How do we do this using these natural spaces? And so there's lots of different subtypes of kind of gardens that we have available to us that we can use. Those might be therapeutic healing gardens, gardens that are accessible in particular ways. I'll show you some examples in a moment. Rehabilitative or restorative gardens that focus on sensory processes like smells or sounds or flavors or tastes. In terms of where you could engage in horticulture therapy, maybe not necessarily with a horticulture therapist, but in just the Louisville area, I thought it would be helpful to present some of these. So if you're outside 264, seems to be the easiest way to organize these. A couple community garden locations there, and then inside 264 within sort of the main city itself, these 9 locations that could be explored further. I don't know anything about the specifics of these gardens. I simply know that they exist and that they are open to people engaging with these communities. So feel free to explore them as you would like. So I'm running a little bit short on time, but let me get through promoting agency and success, right? So when we're thinking about for ourselves and for our patients, how do we promote these positive effects? I think it's important to consider choice, and sort of maximizing the capacity for choice and agency, promoting independence. Trying to find the maximal way to allow somebody to engage with and connect with the natural environment. And that's going to require the right sort of tools that are going to allow individuals to have that sort of experience. And so methodologically, we can think about different options, right, for what sort of spaces can we create, right? So like I said, you can do this in a tabletop with houseplants, outside, inside, whatever it might be, but some good options might be vertical gardens. So these are structures that are set up and designed to allow us to not have to like bend down excessively to access them. There's also these raised, I say sort of a very raised bed down here in the bottom right, which is called the veg trug. That's sort of the brand name, but there are also a variety of other options available. You could arguably build something on top of an old picnic table. And it's essentially a raised bed that is about waist height. So you could wheelchair underneath it, or you could stand next to it, or you could sit in a chair next to it and grow food or flowers. And then hydroponics are a great option. You can find very inexpensive, simple hydroponic setups that can operate on a windowsill or on a desktop. They do require some electricity to run and some occasional maintenance, but there's not heavy bags of soil, there's not a lot of dirt. And so for more kind of healthcare settings or more indoor settings, hydroponic options may be a great way to bring plants into a space where plants aren't normally able to be or concerned about maybe dirt or that sort of thing. In terms of choosing indoor plants, right? Choose things that are low maintenance and hardy. And so some options here on the screen that work for that. If you choose something that's going to be a little bit more finicky, that's going to require particular light, particular humidity levels, depending on the situation you or your patients find yourselves in, that may or may not be something that they can manipulate or control independently. And so finding plants that are going to work well in the environment that that a person is. There are no kind of wrong plants, they're just the wrong locations for those plants, right? So finding the right plant for the right place is key to yielding, I think, some positive effects there. And then finally, in terms of outdoor gardening, right? Mobility is a consideration in aging adults, hand and grip strength is a consideration, and then fall risk. And really in the last, I would say 10 to 20 years, there have been some great inventions here. There are options for, if you Google, gardening tools for aging adults or gardening tools for arthritis, you will find, like down here on the bottom left, some examples of easily holdable or mechanically assisted shears, like a rolling stool that allows you to move around the yard. This kneeling bench, I got one of these for my mother-in-law recently. She loves it. Helps her to kneel down in the garden and then gives her something to hold on to as she stands up. Or we can see some people working with a veg trug-like system here with wheelchairs. It's allowing them to gain easy access to the garden when their mobility is somewhat compromised, right? So we want to find ways to, again, make these activities as accessible as possible. And the internet is an excellent resource. I did about 5 minutes worth of searching to find most of these images. So it's a really easy way to locate what you need given your space, whether you're working indoors or outdoors. to help people engage with nature. So with that, I'm going to go ahead and stop. I want to say thank you for your time and attention. I hope you learned something interesting along the way as we've been talking. If you have questions for me about my research, about forest therapy practice, or my clinical practice, you can visit my website there on the screen, or feel free to contact me at Center College. And then we can go ahead and take some questions now for those of you that are interested. But thank you again, and I certainly hope you find some time to get out and enjoy what nature has to offer. So let me end my sharing.
All right. Well, thank you. That has been a great presentation. We do have a few questions. One question is, do we have healing forests in Kentucky that are recognized as such?
That's a great question. We haven't picked up that process yet. I think a big part of why that was something that happened in Japan so readily was that the National Health Service and their kind of equivalent of the Department of Agriculture and the Interior invested significantly in developing that. One of the main questions that researchers have is, are all environments ideal kind of all the time? You can imagine there are plenty of places in Kentucky that get really hot and sticky, and we worry about ticks and things and mosquitoes, in the summertime that take away from some of maybe the relaxing qualities of nature. So the short answer is no, we don't have any that have been specifically identified as such. But given kind of the range of effect, really anywhere that you enjoy going, where you feel comfortable, where you can move about, where you can spend time, that's going to have that sort of effect. Like having a rubber stamp from a scientific entity is nice, but really what's accessible and what's in front of you, what you're going to use regularly is going to be the most important to access. But yeah, it's a great question.
And then somewhat of a follow-up to that is, it appears that much of the research is centered on Asian countries. What is happening in the US that we are not more intentional about infusing nature into our built environment?
The research is shifting, I think, quite a bit. There are more studies being carried out in the US and Europe. Sweden and Denmark have been also kind of big locations for the support of forest therapy work. But it's definitely something that's picking up in the United States. I don't know if I would say I have like a specific answer for why we haven't been more intentional about it in the US. It could be the fact that most of these countries that are doing this kind of work have like public healthcare systems, have state-run healthcare systems. And so that leads to kind of different decision-making processes about what is and isn't included in healthcare. And so that may be the case, but there is certainly, I think, a big push in the United States now, especially in the last like 4 to 5 years, to try and find ways to promote these sorts of activities. So there is an increase in horticulture therapy activities, increased use of these sorts of practices in skilled nursing facilities. So it's really just a matter of finding the people who are interested in this sort of work, who want to start doing it in those sorts of spaces. And so that's kind of my interest, is trying to raise awareness amongst providers to say, hey, these are things that you can start incorporating in the spaces that you work with.
All right, you kind of answered a little bit of this, but considering the benefits of nature on health and well-being have been noted and studied for at least 40 years, how well received has supportive design been, whether in urban planning or healthcare systems? Like, what progress has there been in its implementation, and what barriers exist from it being more widely used?
I mean, I think there's certainly been more attention to what we could call biophilic architecture in the last 10 to 15 years in the US. So, hospital expansions, hospital development has sort of shifted. It's a little less that sort of sterile kind of beige green, color usage, increased attention to surfaces. So it's been, I think, more sort of subtle, right? it might show up in, as something as simple as having a patterned curtain instead of a solid curtain that's dividing, two beds in a ward or an ER unit or something. But that there does appear to have been more attention to the inclusion of gardens, the establishment of healing gardens in spaces around hospitals or near hospitals for patient access. So, I mean, many hospitals have often had like a courtyard or something somewhere. And I've talked with a few people in different locations who have said that like that's been something that's been built up or actually developed sort of purposefully, or the inclusion of plants maybe in certain spaces throughout the hospital to promote that. I think the main barriers are really come down to awareness and the willingness to make an investment. And so as the data emerges, ideally those who hold the purse strings and make decisions about what do we invest in terms of our hospital and our skilled nursing facility spaces, do we attend to this as something that is going to actually draw patients to us, or that is going to increase their interest and engagement? So I think a big barrier is really just a financial one, right? And a question of awareness. And so the more this information is out there, the more it may lead to positive changes. I mean, there are certainly projects going on. University of Louisville has an excellent project that's been running for a few years, although the pandemic kind of upended it. The Green Heart project that was being run by the oh gosh, what's the it's the Exposome Institute, I guess, out of the Brown Institute at U of L that they've been running, that looks at, how do we increase inclusion and location around the city. So they're planting trees in areas of the city that are particularly have limited canopy. So something worth looking into there.
All right, I think that is our time. So thank you all for joining us today for Breakout Session 4. I would like to remind all our participants that we appreciate your feedback, and this session is eligible for continuing education credits, and to please complete the evaluation for this session contained in the email that you received this morning. Thank you so much, Dr. Godlaski. That was a great presentation, and we really appreciate having you here.
Thank you. Have a great day, everyone.